If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what are the most common signs of diabetes? Answer by Sam Smith. Although diabetes is said to be a disease that surfaces only gradually, the early symptoms of diabetes appear in the individuals all of a sudden. It is for this reason that diabetes is all the more complicated. You might be suffering from the condition, but there are no signs that will help you notice the situation. The symptoms will surface all of a sudden as mentioned above. Some of the common signs of diabetes, however, include the following. Frequent urination as the glucose in the body goes up and the kidneys need to get rid of the same. Sudden weight loss and increased fatigue due to the same as the body does not get enough energy as insulin does not function appropriately. Feeling thirsty at all times as the kidneys get rid of most of the fluids along with the extra glucose. Low body temperature. Feeling weak and tired in spite of eating well. Some of the symptoms of type 1 diabetes apart from the above common symptoms are abdominal pains, sudden mood swings, decreasing blood pressure, rapid heart rate, loss of vision, longer time taken for the wounds to heal, irritation in the child, nausea and a constant feeling of vomiting. The signs of type 2 diabetes which are specific to this condition include the following. Dry mouth and itchy skin, numbness in the hands and feet of the patient, the darkening of the skin in certain parts of the body. This condition is also known as acanthosis nigricans. The above are the early symptoms of diabetes, and if any of your child or family member is experiencing the same, you should immediately consult a medical expert. For more query you can visit their Diabetes Self-Caring, helping people in their diabetes needs. Answer by Gangadharan Nair. There are several types of diabetes. Type 1 diabetes occurs when the immune system mistakenly attacks and kills the beta cells of the pancreas. No, or very little, insulin is released into the body. As a result, sugar builds up in the blood instead of being used as energy. About 5 to 10% of people with diabetes have type 1 diabetes. The symptoms may appear quickly. Type 2 diabetes. The symptoms appear progressively. P plus weight loss. E. Polydipsia, excessive thirst, polyphagia, excessive hunger, polyuria, excessive secretion of urine. This results in glycosuria, secretion of glucose along with urine, and hyperglycemia. Gestational diabetes. It is a condition that occurs in 3 to 8% of pregnant women during late pregnancy. Diabetes insipidus. This can be due to the damage of pituitary gland or hypothalamus. Fibrocalculous pancreatic diabetes, FCPD, is a unique form of diabetes secondary to chronic pancreatitis seen in developing countries of the world associated with either overt protein-calorie malnutrition or, more likely, with deficiency of certain micronutrients. Sources: Diabetes mellitus type 1, Wikipedia. Diabetes mellitus type 2, Wikipedia. Diabetes insipidus, Wikipedia. Answer by Thomas McPhee. Hi. There are no definite signs of diabetes. It simply varies from person to person. In many of the cases it goes unnoticed. Such signs are as follows. Sudden weight loss. You might experience a sudden weight loss of 5 to 10 kg within a month. This happens when sugar metabolism ceases very quickly. Insufficient insulin prevents the body from taking in glucose in the body cells from the blood to use as energy. In such a scenario, the body starts burning fat and muscle for energy. This results in weight loss. Intense hunger. The cells in your body might not get enough energy either due to absence or improper functioning of insulin in your blood. This makes you hungry quite often. Excessive urination and thirst. Due to diabetes, the glucose level in the body goes up. The kidneys are overloaded with the burden of working overtime for filtering and absorbing the excess glucose in your body. The excess sugar, which the kidney cannot store, is excreted out of your body. This makes you urinate frequently. Due to frequent urination, the body gets dehydrated, which makes you feel thirsty more often. Blurred vision. Due to the high level of glucose in your body, tissues gets pulled away from the lens of the eyes. This results in vision issues. If not treated on time, it may even lead to blindness. Increased fatigue. The cells in your body might not get enough energy either due to absence or improper functioning of insulin in your blood. This makes you restless more often, and you may even feel too weak to do your regular activities. If you notice any of these signs, get the level of sugar in your checked and take the required remedies. It is good to get it treated as early as possible rather than facing immense trouble in the future. Also, you can find out more in my ebook Defeating Type 2 Diabetes Naturally.